It's Monday, and we're a little excited. We're going to talk about something you may not know about. It's called thoracic outlet syndrome. Okay, so if you have pain down your arm, weakness, tingling, or anything going on in this region, even some chest pain, could be on either side, typically just one side, you may have a condition called thoracic outlet syndrome. This syndrome is something that isn't talked about a lot. It can happen with people that have a trauma. They fall on their arm, outstretched arm. It could be someone that does a repetitive movement, something there's a lot of keyboard work. It can be, you can also hear about it in, let's say, pictures of people do a lot of overhead throwers, like when you're talking about the athletic population, and they'll have it, sometimes it's constant or intermittent. So let's learn a little bit about it. So there's three types of thoracic outlet syndrome. There's neurogenic, there's arterial, and there's venous. Okay, so those are the three types. The most common type is called neurogenic. It's where the nerves for the brachial plexus, nerves come off your neck, actually get compressed, all right? And there's three sites that we commonly talk about that get compressed, all right? So let's go over it on the skeleton here. So the one right here, so this is our lower cervical spine. They're showing, it's probably hard to see here, there's some nerve roots coming off the base of the spine here and vascular structures that are in this region that come off and actually go through an area right here, like I made. Here's my clavicle or collarbone. It's right in this region next to the neck. They come through here. If you envision the right here, the pen coming off the spine, they run down in a series, go underneath various structures and down into your arm. So sometimes it's not actually the neck, it's actually something after the neck. It's similar to when we talk about compression sites that are compressed. It's similar to people always know about the carpal tunnel. That's a compression site. The carpal tunnel compresses the median nerve as it runs through this area. Well, this is just like a carpal tunnel of the shoulder or neck. So think of it that way. So that's what we got. So, so this is the thoracic outlet area, and we talk about the thoracic outlet. Three sites that you can have this compression, and a compression site that can compress the nerves and vessels that come off the neck. The one are the scalenes. There's a series of few muscles that are on the side of the neck here, right through here, and they actually will compress between the muscles. This is the nerve coming through. These two muscles are running vertically right here, and they actually compress the nerve structures in that region, and that can give you some of that numbness and tingling. You can also have right here, this is our first rib right here at the top, that can be slightly elevated. Here sometimes we'll do some hands-on techniques. We'll push down on that, we'll try and loosen that rib if it's displaced upwardly, okay? We'll what we call mobilize it or stretch it. Some people can do some self-stretches. It's a little hard to do by yourself, but there are some people that offer advice on how to do that. The other structure, the third structure I think about is the pec minor. It's a muscle that comes off of this little spot right here. It runs down to the ribs here. So when the nerves and vessels come past here, okay, they'll get compressed by that pec minor structure and this little muscle right there. So that's some of the sites that can compress. And unfortunately, you can have neck pain with this too. So sometimes it gets a little confusing on where it's actually originating from. But it is something that's out there. It's not really common, but it's definitely something that you have to be mindful of. Probably the scalenes are probably that area, those muscles we talked about up here, those are probably the most common site you'll see problems. If we went for one area that we thought that's probably the highest probability is right in the scalene muscle. So those are probably the ones we want to stretch first. So let's talk about stretching those a little bit. So if you're sitting or standing, it doesn't matter. The good thing is you have good posture. You want to stand nice and tall. You want to side bend your head to this side, and you want to hold that stretch for about 10 seconds, 10 times. If this is your right side, it's the side that you're having these symptoms. As you do that, you want to go away from that side. Okay, so that's the scalene stretch, a typical one. Some people will bend a little bit forward, a little bit back to get different aspects of the scalene, but basically it's going to that side. Okay. The next one we're going to talk about is more for chest stretch, upper chest stretch, or pec stretch. I like to think of it as a doorway stretch, or I call it the goalpost stretch. You want to get yourself into a corner. Let's say you're walking into a corner, or or a doorway, and you want to step forward. You want to lean into it. You want to step into it. So it's good pressure across here. Don't project your neck forward. You're going to hold that stretch for 10 seconds, 10 times, and think about that goalpost nice and upright. The third stretch, which is similar, kind of opening up the upper back, it's somewhat postural, is a thoracic stretch. We're going to do that in sitting. Okay. So we're going to bring our little chair over here. I like to use a roll, kind of keep me upright like so. And we want to, can we see me there? Just rotate me down. Good. All right, we got me. All right. So hands up like so. It's similar to the pec stretch. We're trying to open up the upper back a little bit. So we want to lean back. Good breath in. Let the arms relax back. Keep the neck in neutral. Hold it for 10 seconds and then back. I like to get that breath in, that big breath, and release it because it kind of moves our ribs. It mobilizes the ribs a little bit, and that's why we like to have that aspect of it. And that's why I add that in with a good breath. Realize, so all the way back, good breath in, and release it. Hold for 10 seconds, and then back to the starting position. Okay, so those are the 3 stretches that I recommend. Typically, we'll just pan up the camera here. Got me there? I'm getting shorter. Okay, getting older too. Anyway, so those are the 3 stretches I recommend. Now, you can have a condition called a double crush, okay? And double crush can mean that you have a neck issue, but you also have another issue at one of these sides. So you've got some neck problems that are causing the nerve to be pinched right at the neck, but also, since it's getting compressed there already, it's easier to pinch the nerve further down. So if you're doing some neck exercise, one of the ones we commonly give here is a neck retraction. It's better, but it's not completely better. You might have another second site where it's actually being compressed by the elevated rib right here, all right? By the pec minor that we talked about, and the scalenes. So that is something, they call it a double crush. This guy, Butler, a researcher, looked at nerves and how they get compressed. So I'm gonna give you a quick thing real quick here. If you have a nerve, all right, let's say the nerve conducts at 60 miles per hour. Like every nerve conducts at a certain speed. So think of it as this, all the impulses are going down the nerve here. If your neck is causing, let's say it's normally the nerve goes at 60 miles per hour. That's normally what the nerve conducts at. Let's say if this is the nerve that's being compressed. If it's being pinched at the neck here, it then can go down to 40 miles per hour. Then, further down, it gets compressed, let's say, by the scalene muscles. That's the scalene, which is, oh gosh, I can't even, scalenes. I'll write this out better in the description. It's getting compressed down here. So now the nerve goes from 40 miles per hour to 30 miles per hour. So my point is the nerve is getting irritated at two different sites, okay? So one, you may just have a neck issue and you don't have thoracic outlet. Sometimes you can have a combination. You can have a neck issue and also a thoracic outlet. You can have 2 spots. And that really is sensitive. So that nerve is already a little sensitive because it's getting compressed at the neck. But then you go a little further down, it's getting compressed by the scalenes, or that first rib is coming up and pinching it. It's coming with a pinched nerve. And that can cause symptoms too. So I would start with those 3 stretches. You should not have an increase in your symptoms. It should not hurt any more than it did when you started. Like a brief little burning, whatever, then it goes away is all right. But you don't want to have something that lasts long. This isn't a no pain, no gain, especially when we're talking about neurological structures. We want to really listen to them. Not more than, let's say, a minute or 2 and then stop it. Stretches may not be the right stretch for you, okay? So be aware of that and be careful about that. There's other stretches and things like that for the thoracic outlet. You can go on the internet. We can talk about other options that you can do as far as stretching in future videos. But subscribe to our channel. Please, go ahead and share this with friends. Like us if you like it. And just have a little laugh. I just want a little goofiness at the front there. But I hope this helps you out and gives you a little bit more information on making decisions regarding your health. Please place a comment if you have a comment about a question about that, or if you want us to come in, if you want to call us at the clinic about any specific questions, because every person is slightly different. All right, so consider that, and I hope you got a little extra information today, and you just have a wonderful day, and hopefully less neck pain.